Welcome to Healthcare is Hard, a podcast for insiders. Each episode, LRV Health's Keith Figlioli will talk to the healthcare insiders who are helping to fundamentally transform our healthcare industry.
Hey everyone, this is Tom Priselac of Device Talks. Welcome to Healthcare is Hard, a podcast for insiders. Once again, I'm here with the ultimate insider, Keith Figlioli of LRV Health. Keith's sitting by the Charles, taking in a lovely May day. Keith, how is it out there on the river?
It's a beautiful day today. It's actually spring, and some days it feels like summer, but it's New England, so it could snow tomorrow.
Exactly.
On the springtime, but it's a real day today. It's actually sunny out.
They just had snow in Denver. I had a colleague who reported a snow day on May 6th in Denver. So
I know. I think they had like 10 inches, 8 to 10 inches.
So we cannot complain other than about the Red Sox. But we're not here to talk about Boston. We're here to talk about...
I watched the Red Sox last night. They got crushed by Tampa Bay. It was like a terrible thing to watch. The first game I ever watched all year. Oh, well.
They did. Hopefully they've turned things around by the time people are listening to this. So you've been focusing a lot on AI. I think I did a great job unpacking its impact on healthcare. But now we're sort of steering things back toward the people of healthcare, toward the leaders. And you've had a great conversation here today with Tom Priselac. He's the president and CEO emeritus of Cedars-Sinai Health Systems. He had been at the job until recently for, 3 decades? So he's seen some stuff.
I think more than that. He's been in a seat, or he's been in there since the 70s, late 70s. So to your point about AI, we've been sort of in the classic rabbit hole of AI for a number of episodes. And I just felt like it was good to kind of pull up a little bit and not talk directly about it, but to talk about what I am starting to sense a little bit of across a lot of our partners, which is the CEO's role in leadership right now. And really trying to think about, that's a technological change that we've been talking about, but there's regulatory changes, there's HR issues, there's policy, there's every single aspect that a lot of these very complex organizations that these leaders try to lead. And that was like sort of the pull-up because, I've gotten to know Tom pretty well over the last kind of year or so. And I said at the end of the interview, but I'll bring it to the front here, there's not a person that I have met that has not talked about incredible things from a leadership quotient standpoint when Tom's name comes up. And so I felt like it'd be a great interview, and it was. I think this is going to be one of the better listened to episodes this year. There's just some real subtleties and real key points that Tom brings up about leadership and what you need to think about throughout the entire interview. And then at the end, really talks about, I asked him a simple question about what he was excited about, and then the not so simple question of what he's worried about. The tail end of that interview was everything, in my opinion, which is like his single biggest worry that still keeps him up at night is the cost of care. And what does that mean in our healthcare system, and things like access, things like costs, like all these things, regardless of technological change and everything's great and wonderful. And like these things are going to change everything. But he's like, hey, we still have a massive access problem in this country. We still have a massive cost of care problem in this country. And it's just like really like succinctly pulled the whole interview down to like, if you're a leader, regardless of all the noise going around you, you still have to fundamentally solve these issues today. Then he led an organization that's quite complex as a leading academic medical center and community facility. So he has to manage things like, the most important part obviously is care delivery, but then he has to manage education. He has to manage research. He has to manage all these different things that a typical AMC has to manage throughout the course of their existence. And I think he did it as a masterstroke from what I can tell out there, and it's done a great job. And to be fair, he's got a great set of zip codes and a great place to be. And he's got an incredible board and pulls from a great industry out there and in Hollywood and things like that. But to me, incredible discussion. I was excited at the end of it. I guess you could tell. Like I was very excited at the end of it because I was like, oh, we nailed it. Because like this is exactly what we wanted to do. And Tom really kind of pushed the envelope towards the end of the discussion.
He was leading this entity during a very formative time of healthcare with its evolution and mergers and consolidation. I wonder how the next 30 years are going to be for future CEOs. Is it only going to get harder, or are we through the hard part?
I think it was pretty clear it's only going to get harder.
Yeah.
I think he talked about the level of complexity today compared to the level of complexity he had in the beginning when he started in the industry. And he's like, there's no comparison.
Yeah.
And so I think he had a lot of empathy. It does have a lot of empathy for people that have to lead through all this.
Absolutely. All right. Well, let the lesson begin. You've got your great conversation with Tom Priselac. Once again, he's president and CEO emeritus of Cedars-Sinai Health System.
All right. Welcome back to the Healthcare is Hard podcast. Got a little bit of a shift today, moving from what I think has been a little bit of a rabbit hole in all things AI, and really wanted to move into sort of a higher level order on leadership. And I've gotten to know this particular individual over the last year or so very well, and really excited to have him on talking about all things leadership across very complex organizations such as healthcare systems and payers, but any really large, complex organization in healthcare. But Tom Priselac has previously been the president and CEO of Cedars-Sinai Health System and Medical Center for many, many decades. And Tom, we couldn't be more excited to have you on and to learn from you as we walk a little bit farther into sort of what it means to lead these very complex organizations in our system.
Thanks, Keith. I appreciate it very much. It's great to get to know you better as well, and looking forward to our discussion.
Awesome. So I can't think, as we'll get into this, somebody that joined an organization in 1979 and then went on to lead it for many decades to talk about what it takes to really lead a complex organization in various decades and various scenarios, in my opinion, let alone now, and a lot of things that are going on. And it's probably nice, as you've recently retired, but still obviously involved there, to sort of step back and actually think about that a little bit. And so a little bit of the discussion today, I think, will be in that. But let's pan way back and say, like, how did you even get into this game? What was the impetus to sort of get into the healthcare game?
My original interest was in medicine, and as an undergraduate, did all the things to get ready for that. But that experience, actually, I concluded that the idea of taking care of one patient at a time wasn't of interest, but I still had a broad but admittedly undefined interest in healthcare more broadly on some sort of larger scale. This was the early 70s. And, the country struggled with the cost of healthcare, frankly, from the time the Medicare program started. And back in those days, the avenue to try to deal with that was certificate of need laws. And so actually, my degree is in health planning. I envisioned going to work for a health planning agency. The curriculum called for working in a hospital for a couple of months. The idea of walking in the other person's shoes. And health management students had to do the opposite. But that gave me the opportunity. That's where I was introduced to Montefiore Hospital, which was a small community-based academic medical center in Pittsburgh. Frankly, when I saw what a community-based academic medical center was, with its mission of patient care, education, research, and community service, frankly, coupled and amplified by the people who were just some of the best leaders I've ever come across and greatest people that I ever came across, I said, I'd like to be like them when I grow up. That's really how I got into the field.
Interesting. When you think about sort of that time and then how you got over into Cedars, like, did you ever think you would be there as long as you were?
Well, probably yes and no. I mean, the transition to Cedars, I have to thank, and thank is the right word, the woman who became and fortunately still is my wife. She was from Los Angeles. When we decided to get married, she said, I love you, but living in Pittsburgh was not in her life plan. And I was able to make the move to Cedars-Sinai. In terms of staying there as long as I did, no, I did not plan on that. I wasn't one of those people who had a game plan of I'm going to be here for the next 5 years and then move somewhere else. That's just not kind of who I was. I just wanted to ultimately have a significant role in a major academic medical center in a role that would make a difference. Being CEO was a possibility, but it wasn't an absolute definition of where I wanted to see my career end up necessarily.
And probably a lot of moments, but I'll ask it broadly, then we'll start narrowing down on some of it. But any moments you reflect on now that were kind of shaped kind of your philosophy over those years and many decades of leadership?
I have to give credit to kind of all the people that I worked for and worked with, people who were mentors of mine and colleagues of mine who I think really kind of taught me about what leadership in healthcare was about, as far as the unique distinction of being in a mission-based organization and what that really means as far as the judgments that people in leadership roles make, the importance of organizational values and one's personal alignment from a value standpoint with the organization you're working with. And then, all of the things that are about leadership, starting with the importance of emotional intelligence, but also the change management process and what are the effective steps to being an effective leader. Those were all things that I think I learned from everyone. A little more precisely, actually, probably if there was a defining moment, it was in the mid 80s with the development of the DRG system and selective contracting on the commercial insurance market. That was really a sea change in healthcare and the first time that hospitals began to be at risk to one degree or another. That in turn led to the need for change. So that's probably the defining moment that probably had the most impact. And that's not stopped ever since.
Yeah, there's like a cascade of things. When you think about now, you've taught leadership, you talk a lot about leadership. I've seen you at multiple events do this.
Right.
And your point about values and the system and mentorship, do you think in the current environment that still exists at scale? And what I mean by that is like, are we moving so fast? We've had a lot of leaders like yourself that are kind of moving into retirement. We have a lot of new leaders coming up. Do you feel like that's still there, that mentorship? Are you getting pulled into a lot of those discussions now with the newer leaders and the younger leaders? Or do you feel like because the world is what the world is today, including in healthcare,
Right.
has that changed a little?
Unfortunately, I'll say unfortunately, I think it has changed some, and I think some of that has been, a little bit of that is lost. I think that reflects things on maybe a larger scale in our society, and that's a longer discussion. But on the one hand, I think it's been a little lost, but I have to say, I do sense a resurgence. And what I mean by that is I am continuing in a little bit of an advisor role at Cedars-Sinai. I've been pleasantly surprised by the number of people who have sought out wanting to talk to me for just that reason. They want to talk about the importance of values and they want to understand why that was important to me and things of that nature. So, and in general, I have a sense of a growing sense of empathy and interest in community among young people in their 20s. I think it's the folks in their 20s these days. So maybe the pendulum's swinging back a little.
Yeah, I agree. And my only add to it is it's been interesting in a little bit of my shorter career, but many decades in it too. Early in my career, I had a bunch of mentors. I still continue to have a bunch of mentors, or what I call kind of my board of directors for my development.
Right.
Early in my career, a lot of people seek out me being their mentor. I see less of it now, which I find interesting. I don't know if people just don't have the time, but I think it's a fascinating thing to think about when we continue to have potentially a void of really strong leaders across the space. I always say there's a handful of very strong leaders in the space, but at scale, more than ever, do we need that? And do we need people like you and others that have been around for a long time and seeing multiple shocks to the system?
The need for it, Keith, I think is great. As a society, I think we're sometimes a little schizophrenic or we want it all, and that's appropriate, and that's a very American way. And what I mean by that is people do expect healthcare on the one hand to operate in a business-like way.
Yeah.
But I also think people want it to have the characteristics and community mindedness and things of that nature that maybe were part of more common in healthcare in days gone by.
And then if you step back with that as a backdrop, not to be sobering on it, but how would you describe the job of a CEO of a health system or even an academic medical system, or it could be a community system or both, as you've experienced? What is that job today? Is that job different than when you had it in your early career, do you think?
I really don't think so at the end of the day. And what I mean by that is more than anything else, the job to me is about creating a culture of excellence.
Yeah.
Ultimately, an organization's culture is a reflection of the kind of the actions and the decisions and the words and the behaviors of the people in leadership roles. Creating a culture of excellence in an organization, number one, it's rooted in, I think, the values of and emotional intelligence of the person who is leading the organization. But it's also combined with kind of the tools and techniques that the organization uses so that things don't end up becoming just a series of disconnected initiatives or strategies, but you're engaging in the kind of things that ultimately result in the culture of an organization having the characteristics of excellence and commitment to quality that I think is at the heart of what a healthcare organization is about.
Do you see that in many of your previous peers, but people you also work with now in your role? How do they balance what I think is a very difficult? So early on in my career, I was always told that one of the most preeminent important things of a healthcare CEO is they were a really good politician
Mhm.
because of the role they were in. More recently, over the last decade, I'd say you'd have to take on a lot more building because these have become such big enterprises with
Right.
so many people pulling on you. How do you think about balancing all of that? Because I still think that first point I made is relevant, but the financial pressures, the regulatory pressures. We've been spending an exhaustive amount of time on the technological changes that are going on. How does a CEO keep up with that, especially when something like AI is everywhere in the organization? So not only do they have to be cognizant of what that is, I had dinner last week with 5 CEOs of health systems, and that was the topic. How do we think about this? So I'm just curious, like, how do you think about the push and pull of the different pieces of the current CEOs today?
There's no question between financial challenges, regulatory challenges, technological advancement, scientific advancement, the work of being a leader in healthcare is more challenging now than ever. Number one, I think the people in the organizations are looking for leadership, especially at times of great change like now. The leadership role is, among other things, to number one, help explain to people in the organization and understand what's happening and help them see, number one, see the need for change, but also make sure that they're engaging in an appropriate change management process that is engaging the people in the organization, not only in understanding the change and the need for change, but how to go about doing that and engaging them in helping the organizations adapting to the evolving environment.
So as we're talking about this, Tom, one of the things I was thinking about is like the pace of change is so fast. Do leaders get pressured to make decisions faster in this day and age versus maybe a decade or so ago when things, were perceived to be a little slower? I don't know how much they were, but is that the environment we're in?
I would certainly sign up for the pace of change environmentally to be faster now than it was before. I think the potential for making mistakes goes up in that process as a result of that. And I will say, in retrospect, one of the more important learnings I had myself during my career was coming to appreciate that organizations and people can only adapt so much to the pace of change. When I think perhaps some of our most significant shortcomings surfaced, it was probably when I was pushing for too much change too fast. That was one of those kind of learning moments I had myself. So what that says more than anything else is making sure that, yes, maybe getting through the process more quickly than one did a decade ago, but at the same time, there is a process to go through from an effective change management standpoint, and you can't short circuit that too much.
One of your first points there about a leader pushing too fast and then realizing it. I'm not so sure it's been named yet in the management consulting world, but that is going to be named. I'm convinced of that. There's going to be many books written about it. And, empathy was a big thing for many years, still is, empathetic leaders. But there's going to be something around this idea of recognition of like leaders pushing in this type of environment, which no one can keep track of, with the exception of maybe AIs and agents.
Right.
But then having the presence of mind to be able to pull back and reorient the organization based on that pace. So I totally agree with you. From the leadership stance, the other subject that you're a world-class expert on, which I think a lot of people think they understand healthcare systems, but I think they don't understand them like you do, myself, many others, in terms of the nuances. And what I mean by that is we have many different types of healthcare systems in this country. We have academic medical centers. We have academic medical centers that, something that you help build, like would also have community footprints. We have, large IDNs in multi-states. We have single IDNs in states that are dominant players. We have rural providers. Let's talk a little bit about AMCs, academic medical centers, from your vantage point and what works there. Because I've seen in my career a lot that don't, because of a lot of the complexities of research, education, the different pillars of care delivery. What in your mind, makes a good academic medical center? How do you and other leaders balance those priorities that are a little bit different than, say, someone that just has a community footprint?
the broader and more complex mission of academic medical centers does add a level of nuance, I think, to what's required from a leadership standpoint. The patient care mission of academic medical centers still, I think, ultimately reflect what the primary mission of the institution is.
Yeah.
And admittedly here, this is coming from the perspective of someone who led a community-based academic medical center, where there was never a question about what the priorities were. Patient care was the number one priority, is the number one priority. Research and education were a means to delivering higher quality, better care, as distinct from, at least historically, and this has changed over the years, but historically, university-based academic medical centers created a hospital as a way, because that was necessary as part of the education and research mission. And I'm not suggesting that one is good and the other's bad, but culturally, they do create different environments. There are issues related to the governance in one versus another that's also different. But with respect to the core mission of patient care, that part is shared, I think, universally kind of across all hospitals and health systems.
I would assume you agree with this. I think your really good nuanced point there about the culture and the way people view it. We see multiple models around this country. There doesn't seem to, at least to me, to be a dominant academic medical center strategy in this country. It seems to be there's many different flavors of it.
Mm-hmm.
I don't know if that's true in your mind, but that's my belief in talking to a lot of folks.
Yeah, I think they differ because what's unique about academic medical centers is, on the one hand, all academic medical centers are large community hospitals on the one hand. And that large community hospital, part of them, the rest of it couldn't exist without it, to be honest with you.
Yeah.
And so you're right in terms of their strategies may be somewhat different because they're reacting to those local community differences.
Yeah.
In that regard, they're different. But at the same time, what sets the academic medical center apart is the volume of tertiary and quaternary services for which the market is regional, national, and increasingly international. That element creates different operational as well as financial challenges that's not present in a community hospital.
So everybody has to deal with the partnership administration, so the clinical, physicians. Does the partnerships are they a bit more complex at AMCs because you're also dealing with researchers, PI? You're dealing with not just your point about the care delivery side, but also the research agenda and various things like that. Is that another added burden for the leaders of AMCs?
My comments will be mostly from a community hospital perspective, a community AMC perspective. They tend to be very pluralistic physician environments, number one, not just physician versus scientist, but pluralistic physician environments. So a typical community academic medical center will have a full-time faculty like that, which would exist in a typical university-based academic center. But they will also have a significant physician delivery network affiliated with it in some formal integrated way. They will still have a significant presence of private practice physicians. That admixture and having that admixture, which I personally think is a key characteristic to providing high quality care, is an important thing you want to preserve. Sometimes academic medical centers can make private practicing physicians feel uncomfortable, maybe not appreciate it. But the key to success is creating an environment where everyone can see what their shared interest is, and then making sure that folks understand a rising tide lifts all boats. What that does mean is from time to time, certain emphasis or priorities need to be placed in one area or another. But in the end, the collaboration that is kind of required by everybody for success will ultimately strengthen everyone's opportunity to be as professionally successful as they can be.
I know there was a big tidal wave at the beginning of Trump administration too, with a lot of academic leaders because of the research budget cuts. Do you feel like that wave is normalized a little bit and people have kind of figured out how to manage in the situation that they're in, or that will change in the near future? Or
you mean in terms of organizations' commitments for research going forward?
Yeah.
I think things are in a bit of quiescence right now, is the way I would say it. And what I mean by people know what the immediate, they now have, I think, a better sense of at least what the next 12 months are going to be like. That was not true 6 months ago. I think on the one hand, we're in a certain point of certainty and being able to at least see in the near-term future. And so as a result, people are able to do things like doing next year's budget, for example. Right. They have enough certainty to do next year's budget. The longer term question, I think, unfortunately remains in terms of both the absolute amount of money being put into research and secondly, where those monies are going to be directed.
I had I don't know if it's the pleasure or displeasure of talking to a bunch of AMC leaders the tail end of the month of January to February when Trump took office, and they didn't want to hear a word of what I had to say because I was talking about a bunch of other stuff, and all they just kept hammering me on was research. I was like, I get it. You have no visibility to it. So I appreciate your comments. Maybe turn into Cedars a little bit and think about the key decisions that you made to not only anchor the brand in that market, but more importantly for patient care and things like that. Like, what were the key pivot points over your time there in leadership, decisions that you made that really orchestrated what the organization is today?
There are two, and actually they both go back in their own way to 1994 when I took the position. One was with regard to the academic mission. At that point in time, Cedars-Sinai was already, I think, recognized as an accomplished community hospital that had what I would call a meaningful commitment to academics, but it tended to be focused in a couple of areas. The conversation I had with the board at the time was that, like most organizations, you have to continue to grow and evolve, otherwise you fall back. I was very fortunate to have a board of directors then and throughout my career that both understood the mission of the institution and understood as a business matter the need to continue to grow. And on the academic side, if we were going to be what the institution said in its mission and vision statement, where that played into was their commitment to engage in raising the philanthropic funds that were absolutely essential that allowed us to become what we have become today. That philanthropic funding was really the seed funding that allowed us to make all the investments that were required academically. The companion piece was on the medical network, which in today's world doesn't seem like such a big thing. Integrated delivery systems are the norm. In 1994, that was not necessarily the case. And I can tell you at Cedars-Sinai, that was not the case. It was a very private practice-oriented institution. The creation of the medical network was a major sea change culturally for the organization. But at the same time, had we not made that investment, we would not have been able to become the institution we have, as physicians themselves chose what practice model they were going to be interested in practicing in as healthcare changed for physicians the same way it changed for hospitals. That created the infrastructure on which everything over the next 30 years, I guess, was built.
And to your first point, you happen to have a footprint in a nice set of zip codes tied to a nice industry on the foundation front that I think really to the advantage. I always say, to most leaders in this country, it's always the zip codes that matter a lot in terms of what you can do and can't do strategically. That's really interesting. And then I wouldn't be doing my job if I didn't bring it up, but I think you also did a lot of interesting stuff on the innovation front and thinking about, when I view a lot of the health system accelerators or innovation hubs, I think what you and Darren Dorkin did early on is a very standout thing and still seems to be humming along nicely. I don't know your thoughts on that too.
Thanks. I appreciate the compliment. The creation of the accelerator, I think, is just another manifestation of what has always been as a culture, one of innovation. I would not in any way take credit for somehow creating a culture that didn't exist. A culture of innovation, I think, existed before I got there. It is part of the history of the institution. The accelerator was an outgrowth of, as much as anything else, kind of the academic medical center nature of the institution. We've had a long history of intellectual property and technology transfer that has been a source of revenue for many, many years. And as health, not just the science of healthcare was evolving, we asked ourselves, what else can we do organizationally to help accelerate the change in healthcare delivery? Not just the science, but the delivery of healthcare. And all of this was happening again as digital technology was starting to make its way into the world. All credit to Darren. It really was his initiative to come up with the idea and move the organization forward to develop the accelerator. That was happening in parallel with work being done by our chief financial officer and members of his team who basically were leading our intellectual property transfer effort and simultaneously creating a venture fund at Cedars-Sinai for us to be able to invest not only to increase the amount of outbound tech transfer from the institution, but for the institution to take a small portion of our working capital to invest in advancing companies around the country who are trying to do the same thing.
You guys did that early on, and there's been some scrutiny in the media, I'd say mostly on the private equity versus the venture side, the earlier innovation side, but it almost feels like a strategy that has to be part of a leader's playbook now. Health systems and payers, I would put it broadly, even life science, I'd put it across all the ecosystem players. But because everything is moving so fast now, it does feel to me that this is a strategy that you guys were well ahead of early on, that most players in the market, including even mid-sized and smaller players now, really have to take advantage of.
I do think it's important for every institution to be involved in some way. It does require a certain amount of scale, though, Keith. So I'm not sure the smaller players and even some of the mid-size, but that's not to say that some of those smaller organizations can't come together as an entity of their own, pooling funds in some way to do that. Our interest in doing it, beyond the reasons I have already mentioned, as much as anything else, just had to do with our experience of wanting to help the creative people who are out there develop something that was actually going to be relevant and usable in the market faster. We were approached constantly by people who had great ideas, but you could see that it was going to take more time than we had patience for before it was going to be able to be useful. There was a certain amount of self-interest that was involved in the accelerator as well, about wanting to help get things to a point where they could be usable for us and usable for the larger healthcare delivery systems in the country as well.
Makes sense. And I assume, back to some of your earlier points, like fitting for leadership, fitting for culture, and trying to get the culture of the organization set in moving a little faster, thinking about innovation a little bit differently. There's some programmatic stuff there too, I assume.
Right. Exactly.
Maybe the last two questions. You've seen a lot of this from a lot of different angles, and you've been through a lot of disruption in the space.
Right.
What are you most excited about right now when you think about the space and even the opportunity sitting in front of Cedars-Sinai? Like, what's the most exciting thing in your mind over the next, let's call it 5 to 7 years?
The advances in science and medicine, especially around all of the omics, the advances that are happening in genomics and proteomics, the related aspects of cell and gene therapy, they, I think, are going to revolutionize the treatments of a number of diseases. I think chronic diseases are going to be much more manageable and things of that nature. I think much of the potential of artificial intelligence to both enhance the efficiency and effectiveness of care delivery, as well as advancing the pace of change in research. Those are the things that excite me the most. And among the things that, besides other reasons, makes me wish I was 10 years younger.
It's funny you bring that up, not the 10 years younger, but the therapeutic, what we call therapeutic care evolution. I'm not so sure if the whole industry understands, to your point, like how amazing what's going on up at the research bench and what's coming through. I happen to have a number of people close to me with certain types of cancer these days, and the ability to turn that into a chronic condition, which used to be a death sentence, is amazing to me. And that's just, one indication of a chronic issue now.
Right. Exactly.
I wholeheartedly agree. And you're in the middle of it because, you're in the middle of academic medical center, so you would know better than I would, but it is amazing. I think it's a great point.
Yeah. That has other challenges in terms of the impact on healthcare spending and the cost of healthcare, ironically, at the same time.
Yeah. It's probably why a lot of us are in it, because it is a little bit of a Gordian knot. And if you're really into fun academic challenges that have become very practical very quick, they don't always have simple answers, to your point. And then on the flip side of that, what are you most worried about? So like your point about not being any younger, but you might be coming out of the seat here a little bit. Like, what are you worried about? Or what, to the point of mentorship, what would you be mentoring people about right now? Like, hey, watch this.
Yeah. I'll answer the second question first. What I'll mentor people about is how to cope with the first thing, which I'm about to mention. And that is What worries me a lot, is that the financial pressures that the country is facing and the country and employers and individuals struggles with the cost of healthcare will become so great and already are so great that it's outpacing the ability of the country and the states to make the policy changes necessary to be able to make sure that the country has the kind of healthcare delivery system it needs. The evidence of the system cracking, at least in rural America and in most urban American settings, are already present. And the financial pressures are only going to get more and more strained. And unfortunately, I don't see anything on the horizon that leads me to believe the kind of policy change that is necessary to make sure that, on the one hand, affordability is being addressed, but on the other hand, there's an actual delivery system where people can be cared for in the way I think Americans want to be cared for is going to be there. However, we've gotten to where we are, there are winners and losers in healthcare delivery around the country. Unfortunately, for those communities that are now suffering from lack of availability, you have a situation where on the one hand, you have communities suffering from lack of availability. On the other hand, you have hospitals in urban areas that are running at 110 or 115% of capacity. And the proverbial stories of people spending 7 hours or more in an emergency department waiting to be admitted. We've got to figure out a way to address both of those issues simultaneously in a more effective way than we have to date.
Yeah, I think it's well said. And I wouldn't say it's not talked about enough, given everybody wants to talk about the incredibly interesting, sexy things. But the basic problems, to your point, are still not fundamentally being solved.
Right.
I do hope, along with you, that there's not just a day, there's many days of reckoning on this point. But, what becomes the seismic thing to be able to do that? Is it a leadership quotient? I don't think it's just a technology quotient. I think a lot of people are hoping and praying that we're going to bend the cost curve with all this AI stuff. I don't know if I'm there personally. I think it'll help, but it may hurt too. It may increase the cost.
Yeah, unfortunately, change seems to happen in our American healthcare system when something tragic happens.
Yeah.
Or something reaches a certain magnitude that it can no longer be avoided. That's worrisome.
Yeah.
That's worrisome.
So we're not going to finish on a down point. So I'm gonna end us on a high point, which is, Tom, one, I can't thank you enough. Two, I can't thank you enough for the growing friendship we've started courting. You are one of the people in the industry that I have never brought up your name, and I have not heard incredible things about you.
Oh,
and
wow.
I think there is a testament to your work, testament to your leadership, and a testament to where you went in the beginning, which is your value system comes through every time I talk to somebody about you. So I just want to make sure I tell you that.
Thank you. That's very kind. I appreciate it.
I truly appreciate you coming on and sharing these lessons.
Thanks. Happy to do it, Keith, and really looking forward to working with you some more going forward.
Well, that's a wrap. Thanks so much for joining us on this episode of Healthcare is Hard, a podcast for insiders. If you want to follow Keith Figlioli, he is on LinkedIn. You can find him there at Keith Figlioli. If you want to share this podcast, make sure you copy Keith and myself. We'd love to be part of that conversation. You can find me on LinkedIn as well, Tom Salemi. You can also find me on Twitter at MedTechTom. I'm the editorial director of the Device Talks events and podcasts. So look at devicetalks.com if you're interested in the medical device field. That's it, folks. Tune in next time for another great episode of Healthcare is Hard, a podcast for insiders.
This podcast was edited by Resonate Recordings.